month, Pinktober, and we are almost halfway. Not almost, we are halfway to the Pinktober period. Because today is 16th, and so I think it's a fine moment to bring this subject to the front and discuss it proper. And this morning on the show, I am blessed to have some great, wonderful ladies from the Anglican clergy spouses, Accra Diocese. So, Accra clergy spouses medical team who are here to help us with this conversation on breast cancer. And so, quickly, let me go ahead and do the introduction. Sitting straight right across from me is Dr. Nabake Sego, and she's from the St. Augustine Parish in Dansoman, and she's a member of the medical team for Accra Clergy Spouses. Dr. Nabake Sego. Good morning, man.
Good morning.
I believe you're doing well. I'm doing quite well. So today's conversation is about breast cancer. And I don't know, are we exempted as men? This is on the lighter note too.
Oh no, men can get breast
We are also
cancer.
part.
Yes.
Okay, so now it's a cue for our gentlemen to also pay attention. Because usually when we are having such conversations, the men will think, well, this is not our business. At least now we know from the experts. Men are also part of this conversation. And then also, to my immediate right, Mercy Calistego. Mercy Calistego is also from the St. Barnabas Parish in Osu, and she's also a member of the medical team, Accra Clergy Spouses. Good morning.
Good morning.
How are you doing?
I'm fine.
Okay, so I love your pink jacket and your pink ribbon. I mean, this, it's sad that I don't have some. I should have worn some. I should have worn some.
At the end of the
Yeah, at least the pink ribbon to also signify that I'm part of this whole, breast cancer awareness and stuff. But thank you, ladies, for coming and then gracing us with this conversation about breast cancer. But let me begin the conversations with you, Dr. Sego. Breast cancer, I mean, we've heard it a lot, but what exactly is it?
Okay, so when we say breast cancer, we mean that there's a cancerous growth in the breast of the woman. So a cancerous growth is one that goes unchecked. It doesn't follow the normal regulation that other cells have. And it invades, it spreads from the breast into the chest, into the lungs, to the brain, to the bones. And
So breast cancer can grow from the breast and then enter other parts of the body?
Yes, please. That's what makes it cancer.
Oh. I thought it was limited to just the breast because it's breast cancer.
No, please.
But breast cancer, I mean, it's a global situation. But in Ghana here, I mean, what are the numbers? What are the statistics? How many women are suffering from breast cancer? What are the figures that we have relative to this subject?
So we only have approximate figures.
Right.
Because there are a lot of women who don't even come to the hospital and they die in their communities. So from the data that we have, so in 2022, there were 5,026 new cases of breast cancer. So that's those that report to hospital who are diagnosed. So those that we know, 5,026. And sadly, in 2022, 2,369 women died from breast cancer.
Is that serious?
It's very serious.
5,000, in excess of 5,000 cases in 2022 alone.
Yes.
And then what? 2,000, over 2,000
died
as a result of breast cancer.
breast cancer.
Wow, this is serious.
It is serious.
But if these are only for the numbers that came forward to report at the various hospitals, I mean, if you are to look at those in the house who may not come to the hospital to report, and you are to give a raw figure, would you think it will be crossing 10,000?
It's difficult to say. It is difficult to say because of the stigma attached to it. But that's one of the things that we'll talk about later in the show.
Right. So let's then look at some risk factors of breast cancer, considering how serious this particular subject is. What are some do's and don'ts? If I want to stay away from breast cancer, I mean, what are some of the activities that may put me right in line to perhaps be getting breast cancer?
Okay, so one fact needs to be established, and that is the actual cause of breast cancer is unknown. But like you're saying, like a question comes to me, risk factors. So risk factors are things that makes one prone to something. Okay, so with breast cancer, one is that when there's a family history of breast cancer, you are at risk of also getting breast cancer. You have the 50% chances of also getting breast cancer. And so we have people who in their family, there's people who have suffered from breast cancer or have died from breast cancer. So that can put one at risk of having breast cancer. Sedentary lifestyle. So you are just living your life anyhow. You are eating unhealthy. You are not washing your breasts often. You are not cleaning your breast under your breasts often. I mean, you are eating everything, drinking alcohol. So sedentary lifestyle, living your life anyhow, and unhealthy lifestyle, like I said earlier on, not having healthy lifestyle, not washing your breasts, cleaning your, I mean, under your breasts often, and obesity. So people who are obese are also at risk of developing breast cancer. People who are obese are also at risk of developing breast cancer, and some hormonal therapies. People who are put on hormone replacement therapies after menopause also ends up getting, majority of them ends up getting breast cancers. Then family history. So family history is cancer, people who have suffered from breast cancer. So it is linked to your genetics. So if there's something that runs in your family, means it's a genetical
likely to get it
problem.
as well.
Yeah, so you're likely to also get it as well. And alcohol intake. So excessive smoking and alcohol intake can also predispose you to getting breast cancer. So basically, these are some of the risk factors of breast cancers.
Yeah.
Yes.
Back to you, Dr. Sego. Do we have types of breast cancer? And if there are pictures to be shown,
We have some pictures.
you have some pictures,
Yes,
right?
yes.
So tell us about them, and then
So we have different types of breast cancer.
They can arise from different parts of the breast. So some can come from the fatty tissue of the breast. Some can come from the part of the breast. So the picture is showing now. Yes. So if you look at the picture on the left, you can have cancer coming from the lobules or the ducts of the breast. So from those places, that's where the breast cancer can arise. And you can see that the breast itself lies over the muscle. So from the breast, the cancer will then grow into the muscle. And then behind your chest muscle is your lungs. So it will go into your lungs. That's one of the common ways in which women die from breast cancer, especially that. So you can't breathe. You can't breathe. Okay. Then if you look at the picture on the right, you see that
We have something called lymph nodes. So the tumor can also spread along the green things called the lymph nodes. So you can see that the lymph nodes are close to the blood vessels. So from there, you enter the blood vessels, then to any other
part of the body.
That's how.
but these are internal.
Yeah, these are all internal.
internal,
So
that's why.
that one you may not see. But as you can see from the left, the breast is visible and palpable on the chest.
Right.
And that is why we want women to be examining their breast. So if you go to the next slide, you see some of the things that women may find when they examine
Right.
their
Let's go to the next slide, please. Okay.
So the normal breast,
the skin is smooth.
so if you
See changes, this
dimpling of the skin,
like an orange.
it means that the breast cancer
There's just
is,
too many holes there. These
so
are
it's infiltrating the breast.
right.
It's pulling on the tissue within the breast. So that's why you see it like this. We call it pod orange or like an orange. The skin of your breast becomes
Like an orange.
So this is supposed to be the breast.
yeah, this is part of the breast.
This is not supposed to be the breast.
it is somebody's breast.
Somebody's breast.
So the person came to the clinic and the picture was
So
taken.
it's someone's breast that was
Yes.
taken
Yes.
like this.
Breast
Yes.
cancer.
Wow.
This is the patient. This is how the patient
Presented at the OPD.
I thought the breasts were supposed to be smooth, but this isn't. So this would be a
This is
what
a
a
abnormal-
serious stage of
Yes, it will be serious.
right.
There's another picture. We have another picture.
Right. Let's go on, please.
So in this case, the person
Person has a lump. Where you see the arrow,
there's a lump there, and the lump has pulled the breast back. So you see that the shape of the breast has changed. It doesn't hang down anymore. It has been pulled as though it's stuck to the chest. So this is also how the person presented at the OPD. Then the next picture.
Okay. This is almost looking like a gentleman's breast.
And so you see that it has the cancer has pulled the breast onto the chest. So you can see the difference between the normal breast and then
This one, right?
breast.
Let's go to the next one. Let's take the next slide.
So you can see that the
things at the top of the skin, that's the breast cancer, is coming through the skin, out onto the skin.
and the nipple,
The normal nipple
is
Out.
it should be out.
or even if it is in, you can move it out. But in this case,
No matter the amount of
palpation that you do, the nipple will not come out.
Right.
The tumor is behind it and is pulling on it. So these are some of the, these are even the early stages. There are some that are worse. And these people can come with very big ulcers, even rotten breasts in the OPD.
I'm sure there are more pictures to be looked at, but let's take a quick turn. We'll be back shortly, and then we'll continue our conversation on breast cancer. Stay with us.
Mommy.
What for?
In fact, I feel my fed up. Maybe fear. Because Ghana be a men because it was in trouble.
And almost a better be drawn 1 year break.
To maybe fear why she remember.
Bye bye.
Okay, bye bye.
Mamma, what to say?
Of when you're mere drum, no way. Now, of our bay, me did this over beton. You better be drawn wash. Offer. Dr. Wayne and Pesse, you could try no share.
Doctor, we are that papa.
Of our water there.
Yes.
She's at the BM Casa, the Dima for her hospital had the yes, and the move. And I say, yes, you look pet and Dr. Tamdas.
You true do.
Yes.
You call somebody more than
yes.
You mess up. The Dima for her hospital. Aha! Let me feel brochure Benyama Yarisa. Hey, I didn't some crap. Dr. Tamdas. I just salute you. Hey!
Medima for Heba Hospital. Ewo Kumasi, Ebuakwa Meku, and Kransopokrasi Mayra. Through Dr. Tamdasu 0244 774 282 and 0500 7272 15. Dr. Sebra, now Yari, what a tad better soon.
Welcome back. Thanks for sticking with us. So Dr. Sego was telling us about this breast that we are looking at on the screen right here. And then, of course, this is quite visible. I see the nipple is almost entering the breast itself.
Yes.
It's going inside.
Yes. So the tumor is, the cancer is pulling
It's pulling it inside. Right. Let's take the next one then.
So we want to talk about the issue of what is done about it. We have different treatment modalities. We have surgery. We have chemotherapy. It's the surgery that people are so afraid of, but this is a diagram showing what is actually done when we say removal of the breast, mastectomy, and what it looks like afterwards. So if you go to the next slide, you see it on a real person. The person graciously allowed herself to be photographed so that other women will see.
So mastectomy, like. The removal of the breast, I mean the cancerous breast.
Yes, the cancerous breast.
Right. Let's do the last slide then.
So this is what it will look like
after the breast is removed.
After the breast is removed, this is what it.
So it means the other one is what, cancer free?
Yeah, the other one is cancer free. So that one has not been operated upon.
Right. But are there no tendencies that after this one being removed, the other one could also?
Yes, it can happen that if you've had breast cancer in one breast, it can spread to the other breast. So even if you've had breast cancer, you need to be coming for checkup, for follow-up.
Right. Dr. Tigo, add a few to these signs and symptoms.
So, like Dr. Sego said, we have dimpling, we have retracted nipple. So the rest, some people experience discharges from their breasts, unlike breastfeeding mothers who are having breast milk coming from their breasts. But in some cases, with people with breast cancer, they have blood discharge, greenish discharge, yellowish, brown, any discharge that comes out from your breast is alarming, and therefore you should walk to the health facility for you to have your breast examined. And some breast cancers comes with pains, others do not. So immediately you realize there is pain in your breast, or you realize there's a lump apart from the actual lump that is there, you need to. So that is why in the month of October we are asked, and even if it's not October, you need to do self-examination at least every month after your period, so that you can know if there's a lump or not. And sometimes the lumps also gets under our armpits, so that those are also one of the signs. And inflamed, the breast becomes so reddish, it becomes reddish as if someone has poured hot water on it. Yes, so basically these are some of the signs and symptoms. And Dr. Sego was talking about the treatment modalities. So sometimes we do lumpectomy, the removal of just the lump. The mastectomy is the entire breast. But sometimes the removal of just the lump is that is what we call it, lumpectomy. So the treatment modalities depends. So when you come and see our doctors, they will tell you what treatment modalities you need.
But with the second one you mentioned, said
lumpectomy.
Lumpectomy.
Yes.
But would that leave the breast as sensitive as it was, or what? It will take the sensitivity away?
Okay, so it is the tumor is taken out and sent to pathology for it to be seen if it has spread to other parts of the body. But if not, just that cancerous tumor is just taken out. But when it is sent, because when the lump is taken out, we just don't leave it there. We take it to the lab and make sure that it is just at that part. So with that, it's not just the lump that is taken off. Healthy lumps or healthy tissues around the lumps are also taken in addition to the lump to the lab to see if it has spread to those healthy tissues or not.
But, and after the lump is removed, I was asking, would the breast still remain sensitive to touch, perhaps for sexual purposes?
Yes, it will. It's just the lump that is taken out. Yes. But in cases of the mastectomy, the entire breast is taken. So in most cases, people go for prosthesis, artificial breast, for them to have their breast as equal as the other.
Now, we have like 5 minutes, and I want us to use the next 5 minutes to talk about the event that you'll be holding, the free breast cancer screening. So let me divide it. So 2 minutes, 2 minutes each for this one. Let me come back to you now, Dr. Segu. I've been confusing Segu and Tegu. So Dr. Segu and then Dr. Tegu.
Same way.
Okay, let's come back to you now. So tell us about the event. When is it holding?
So it's coming on this Saturday at 9 a.m. at St. Francis of Assisi Anglican Church, Mampobi. So we are inviting the general public, those who are especially living at Mampobi, to please come and be screened. We want to screen people because people are sometimes shy to even go to the hospital. So maybe somebody in a non-hospital setting, they may be willing to be screened. The more opportunities people have to be screened, the better. Sometimes people are just afraid. They may have seen a lump, but they are not sure, and they're afraid to come to the hospital. So please, we are calling all those who stay around Mampobi, those who are interested, please come, let us examine your breast. Even if we don't find anything, we'll teach you how to keep on examining the breast, so that even in the privacy of your home, you can be doing it.
Saturday, you said Saturday.
This coming Saturday. 19. So today is 16, so in 3 days' time. So what we've realized is that if the breast cancer is caught early, that is only in the breast, and it is removed and the treatment started, 10 years, 95% of people are alive and well. So the earlier it is detected, the more the success rate is very, very high. Nobody needs to die from breast cancer.
Add some more to it for me. Mampobi, St. Francis of Assisi. If I'm coming from Kaswa, and I mean for the directions, okay, maybe you should add that one for me. Okay. From Kaswa, I get to Circle, and where?
From Circle, then you take a Kolebuka or Mampobi car. Okay. So once you alight at the Mampobi post office, the church is just a short distance from the
Mampobi post office.
Yes. Okay. So once you alight at the Mampobi post office,
Mampobi post office, then the church is what?
It's a short distance across the road and left.
So that's where the activity would be happening. The event will be happening.
So get to the Mampobi post office, and from there the church is a short distance. A stone's throw.
Are there any dedicated telephone lines that anyone interested could call for any kind of info. You
Oh,
don't have the numbers
we
there?
have a
You have-
we have
okay,
a
okay, then you
that's
can go
the
ahead and put
that's the breast society. It's on the slides. The
Okay,
breast
yeah.
society of Ghana has a helpline 055 999 4747.
Right.
So we are appealing, if you are at home and you have any questions, or if you examined yourself, you are not sure, you know somebody who needs help regarding breast cancer, please, this is the number 055 999
Right.
4747.
Okay, so that's it. 055 999 4747.
That's the Breast Society of Ghana. The
It's
Breast
quite easy
Society
to
of
grasp,
Ghana
though. Yeah.
is composed of doctors, nurses, breast cancer survivors. They are family members, so it's not only doctors and nurses. People who have experienced it, have gone through the treatment, have come out successfully. They are there to share their experience. If you want to even see what it looks like after you've had lumpectomy, mastectomy, they are willing to share with you. So it is not only doctors and nurses, but also breast cancer survivors.
Well, thank you very much for coming to educate us on this rather important subject. But Dr. Carlos Tego, we are just about wrapping up. So in a minute, your last words and then.
Okay, so my final words are that early detection saves life for most cancers. So if you come early, I mean, your breast cancer can be handled by professionals. And we should also stop stigmatizing. The stigmatization is too much. People are even called by their health conditions. In our society, people are mentioned, instead of saying Antiama or Mamena or breast cancer, or this lady who has breast cancer. So the stigmatization, because they go through a lot of things, a lot of changes. Imagine you have a full breast and all of a sudden that breast has just been taken off. So the society needs to help, and we as healthcare workers also need to give our optimum best in caring for these patients. So these are my last words.
Well, thank you very much. Your last words too, and then.
Oh yes, and mainly on the stigmatization. A lot of the women go through depression, anxiety, guilt, financial distress. They are so unhappy about themselves. So as a society, we don't have to add our own societal stigmatization to it. We exclude them. We do not visit them. Sometimes people are even afraid. If you go to this person's house, you may also get the breast cancer. We give all sorts of unsolicited advice and unkind comments. So because of that, sometimes patients are not willing to come to the hospital. They keep the disease to themselves and die by themselves. So this October 2024, we are asking, stop the stigma and be supportive.
Right. Well, thank you once again, Dr. Nabake Segu from the St. Augustine Parish in Dansoman, and then Dr. Mercy Carlos Tego, St. Barnabas Parish, Osu, came to educate us on breast cancer. And the free breast screening, emphasis on the word free. Free. It's happening on Saturday, 19th of this month, just a few days away from today. In fact, 3 days away from today, Saturday, Mamprobi. I know the Mamprobi. I want to find the name of the church. The parish is Saint Francis of Assisi.
Yeah.
Saint Francis of Assisi, Mamprobi. And it's quite close to the Mamprobi post office, right? A few distance from the Mamprobi post office. That's right. So you take advantage of this wonderful opportunity. It's going to be free. Then have your breast screened. Then if you know your status, if there's any cancer element or cancer cell
or lumps. When you
cancer
screen,
cell
you
or
look for
lumps,
lumps.
yes. Yeah. If there are any cancer cells or lumps in your breast, then you know how to take it from that moment. If they are not too, the education on how to stay cancer free also would be given. So this has been AM Ghana on Delta Television. My name is Anakwame Socrates. Enjoy the rest of our programs and have a lovely day.